off on our tangents.
Space time and beyond.
Now I'd like to go over with you what it is that you're going to end up doing all the time. We have discussed and gone through reasonably thoroughly the diagnostic protocol for when you're doing the whole protocol. Most of the time, people are going to show up with, oh, it hurts here, or some particular specific issue that they want to resolve. And that's what you want to do, is resolve that for them. And as that relationship goes along, at some point they'll want the complete diagnostic, particularly once whatever it is they've come to see you for begins to resolve itself, okay? So, when someone comes in, you need to know where to go looking for the problem, all right? So, your first statement is, this issue is a physical plane issue. So physical plane is bony structure, soft tissue, nerve tissue. That means that the issue is somewhere in one of those systems.
Bony structure, soft tissue, nerve tissue.
Right, that's the physical plane. You get a weak response, it's not physical plane, then move on to this issue is metabolic plane. And this is where you're going to find the majority of the issues on the metabolic plane, because it's the largest. And so if it's a metabolic issue, you would then make the statement, this is an issue with endocrine. Weak response, that's not it. Then you would make the statement, this is an issue with organs. Again, if you get a weak response, move on to the next category, which would be, this issue is with pathogens. And you get a strong response on pathogens. So, our choices for pathogens would be bacterias, viruses, parasites, toxins. Let's say that we went through the metabolic and well, actually we got a weak response and we're not supposed to look in the metabolic. That's not where this issue is from. So then we would move on to
Emotion.
this issue is emotional. Sometimes we can be beneficial with these emotional issues by providing the appropriate flower. This is the opportunity for you to exercise that giant network that you've established of other practitioners so that you can test and see if there's someone in your network that they can see that will help resolve these emotional issues. And if it's not emotional, the last choice is, this is a spiritual plane issue. If it is in fact a spiritual plane issue, hopefully you've gotten yourself hooked up with a couple of shaman and you can test as to which would be the best shaman for this individual to see.
Lisa's still practicing down there?
Yes. So when somebody comes in with an issue, these are the first inquiries that you make, and you can narrow it down very quickly where it is you're supposed to go look for this issue. I don't know if anybody has someone in mind. Remember I said that it would be nice if we had some ideas about people that we would like to kind of nail a specific issue on. Somebody got one of those in mind? You have one in mind? Come, have a seat. And you guys don't just sit there. Think about somebody else who has a single issue sort of thing that we can have a look at. So what's this person's first name?
Jeanette.
Jeanette. Okay, the issue for Jeanette.
A burning tingling all over her skin, almost she said daily. I don't know if she said night or daytime, but
Okay, burning, tingling on the skin.
all over.
Okay, fine. So, show me strong, good, and weak. Yeah, safe and appropriate for you to surrogate for Jeanette. Yes. safe and appropriate for Jeanette to receive you as her surrogate? Yes. So, burning and tingling sensation as described. Boink. So that's the stressor that makes her weak. So, this is a physical plane issue. No. This is a metabolic plane issue. Yes. This is an issue with an organ. Yes. And the organ is skin. Yes. The issue with skin is one or more pathogens. Aha. No. The skin is being aggravated by one or more of the organs. Aha. Yes. The skin is being aggravated by liver. Yes. Remember that liver is the #1 organ for detoxing our body. And when liver gets overloaded, skin is next. That's what's the next issue for cleaning the body. So, liver is 100% of the issue with the skin. Yes, all right. The problem with the liver is cirrhosis? No, okay. The problem with the liver is one or more of the miasms. Yes. So now, as a stressor, leucinum, boink, yep, that's a weak response. So, leucinum is more than 99% of the problem with the liver? Yes, leucinum is 100% of the problem with the liver. Yes, and so the remedy for this is Merck salt and syphilinum. Yes. That is complete? No. Okay. Also needs chelidonium. Yes. So chelidonium, Merck and syphilinum is greater than 99% accurate. Yes. Is 100% accurate? No. This requires an inflammation remedy. Yes. The inflammation remedy is belladonna.
Belladonna.
No. Is capsicum.
Capsicum.
Yes. So capsicum is the inflammation remedy for the liver. Yes. So now, capsicum, chelidonium, Merck and syphilinum is greater than 99% accurate. Yes. Is 100% accurate. Yes. Is needed at greater than 25 m. It's greater than 50 m. No. So all potencies 30C to 50 m. The skin needs a remedy as well. No. So this is complete for Jeanette? Yes. So this surrogation for Jeanette is complete.
Thank you.
Nice.
Okay? Did you follow that sort of train of thought, how we get to that? And Jeanette's burny skin turns out to be her liver. Imagine that.
I have one too.
Okay? So, yes, we have another one? Please.
Thank you.
This is it right here. I don't know if I spelled everything right. Write mine down.
You get graded on spelling them. Oh, boy.
So, what's the person you want to check out?
Jalen,
Jalen. Oh, okay. And what's the issue for Jalen?
acne.
Acne. All right. So, safe and appropriate. Well, here, let's start here. And show me strong is good. And weak. Perfect. Safe and appropriate for you to surrogate for Jalen. Yes. Safe and appropriate for Jalen to receive you as his surrogate. Yes. Skin issue. Good, so that's the stressor. The issue with skin is acne. No. The issue with skin is bacterial. Yes. So let's see our little list of bacteria. And let's say, as a stressor, A through M, yes? Okay, so it's in there. So again, it has a stressor, A, B, C. Yeah. A. No. B. Yes. So let's try Borrelia. Yes. So the bacteria Borrelia is more than 99% responsible for this skin condition. Yes. Is 100% responsible for the skin condition. Yes. So the remedy for Borrelia is cupromet. Yes. Echinacea A. Yes. Pyrogenium. Yes. For Borrelia, that's greater than 99% accurate. Yes. Is 100% accurate. Yes. And covers the inflammation? No. This requires belladonna. Yes. This remedy provides adequate drainage. No. Requires heparsulf. Yes.
She looked at you on that one.
So,
What?
cupromet, echinacea A, pyrogenium, did I just say heparsulf
Belladonna.
and belladonna. This remedy is 100% complete and is needed at greater than 10 M, at greater than 25 M. No. So 25 M to 30 C. So this is complete then.
Surrogation is complete.
The surrogation is complete. Whoop. There's another issue, Jalen. Aha. See, he didn't want to stop when I sit with the surrogation, and he went, no. Okay, fine. So the additional issue is physical plane? No. Is metabolic plane? Aha, no. Is emotional plane? Yes. Need and use one or more of the flowers? Uh-huh. So, agrimony through larch? Yes. A, B, or C? No. Elm, gentian, gorse? One of those. Elm? Elm. Jalen, need and use elm at greater than 5 M, greater than 10 M. At 10 M, just 10 M. Yes. Need and use one or more additional flowers? No. This surrogation is complete. Aha, no, you want something else. Need and use a color.
My poor child.
He wants a color. So, red through blue? Yes. Red or amber? Yellow. Yellow. Yellow in an M potency? Yes. Greater than 10? No. And just 10 M? All right. You need to use one or more additional colors? No. This surrogation is complete. Oh, there we go. He's ready to be done.
Nice, thank
Okay,
you.
there we go. So, you see what can happen there is, I mean, that was a wonderful example. When we went to end the surrogation, Jalen said, no, you're not done. Kind of like, okay, fine. So we just go on with the testing, okay? Okay.
Wow, okay.
And the question,
I said I had one, if you want.
Oh, you have one?
I have one from the.
Oh, yeah, please, come on.
Borrelia, that's the name of the bacteria. Okay, and the remedy is
And who do we want to do?
at
Dominic.
30 M.
Dominic.
So
Okay.
30 C to 25 M.
So, show me strong here. Good. And weak. Perfect. Safe and appropriate for you to surrogate for Dominic. Good. Yes. Safe and appropriate for Dominic to receive you. Good. So what's the issue for Dominic?
He wakes up every night,
Wakes up every night, okay?
so it's like fatigue, he's not getting enough sleep.
Okay. So, waking at night. For Dominic, waking at night is a physical plane issue. Is a metabolic plane issue. No. It's an emotional plane issue. No. This is a spiritual plane issue. Yes. This requires a retrieval. No. This requires an extraction. The spiritual plane extraction issue is more than 99% of the sleep issue. Yeah, is 100% of the sleep issue. Yes. I have some best good for Dominic to see a shaman. Yes. To see Lisa. No. Gretchen. No. Connie. So Connie's the right shaman for Dominic.
That's what I
Okay?
just wanna find out.
Okay, so, back. This surrogation is complete.
Thank you.
Okay.
Sorry, no.
Who's Dominic?
He's a friend of mine, he's been talking to me, he bought a house, and he's got,
No, don't need that.
Okay.
I need another example. Here we go. What do we got here?
Mia and the pressure in her eyes.
Mia?
Mia,
Oh, Mia.
yeah, and the pressure.
We're working on this.
Really?
Yeah, we're working on this. We changed her formula last time.
We did?
Yeah,
Can you figure
it's up to date.
out? Oh, okay. What else do
Okay.
you want?
Got anybody else in mind?
My mother,
Mom, what's Mom's first name?
Georgina.
Georgina. And a specific thing for Georgina?
Her pain in her, she's got like pain in her joints, and it seems like her hips and her knees are affected.
Okay. And here we go. Semi-strong. Perfect. And weak. Perfect. Safe and appropriate for you to surrogate for Georgina. Mhm. Okay. And Georgina to receive you. Yes. So, joint pain as described. This joint pain is a physical plane issue. Is a metabolic plane issue. Ooh, is an emotional plane issue? Oh my goodness, it is. And spiritual? No. This joint pain is greater than 99% emotional? Oh my goodness. Georgina, highest and best good to identify this emotion. Yes. So in our emotional list, this is A through M. No. Is N-O-P? Is N? Is O? Is P? All right, so let's see. In this list we have and so going through the P list, this comes up as pangs of guilt. So pangs of guilt is 100% of the cause of the joint pain. There is a flower for this. Oh no. We have a color. No. We have a remedy. No. We need a therapist. Yes. So we don't have a remedy for that. Georgina needs to see a therapist.
What about one of the notes? Is that, or not?
Yeah, it's not,
No.
it's not going that way.
Okay.
Highest and best good for Georgina to see one of the therapists that I know. No. Do we know if she has any experience or opinion about, seeing a therapist?
I think she's open.
Okay.
It's just a matter of finding someone that
Speak Spanish.
speaks Spanish.
Oh, okay, yeah, that's gonna be an issue. So, what you're gonna have to do is come up with a list of therapists, and then we will muscle test as to which one is the most beneficial for her to see. Okay? Okay?
Are we done with the surrogation?
Oh, right. Don't want to leave you there. And the surrogation with Georgina is complete. There. Okay. That's complete.
I have a question for you, Dr. Mitchell.
Yes.
When I get ready to make this remedy for my son, I know that the remedy consists of these things at 30C to 25M, and then I want to add the elm and the yellow.
Right.
So
You
how
just
do
breathe
I?
them in separately.
So I do the bulk first, and then I go back and add. Say I'm adding.
No, you're not adding. You're not saying you're adding anything. It's just as if you're continuing with the list. What was it? It's Cooper Med, Echinacea, Belladonna,
All at 30C.
all at 30C, and then what? Elm?
Elm at 10M.
Fine. You
And
just
then
say
yellow at 10M.
You just say elm 10M, yellow 10M.
Okay.
Yeah, just do it all at once.
And then how do you know how many times a day they should take a pellet?
3 times a day. I just always go for 3 times a day. You get so much better compliance.
Okay.
Is
3
there
times
time
a
for
day.
me?
Huh?
Is there time for one for me?
Sure.
Can you do my notes?
Yes.
Here.
I'm the secretary.
Thank you, Diane.
You're welcome.
The dealer, she's the secretary.
I'm the dealer. The dealer's the secretary.
Who are we interested in?
Lupe, my son.
Lupe. And what's up for Lupe?
Allergies, animal allergies, and hay fever. You know, elements.
Okay, I can tell you definitely that he'll probably want some of the dropper bottles, which are beneficial for the symptoms. When there are allergy issues, it means there's a whole lot of stuff going on throughout all of this mucous membrane. Tuberculosis, pneumonia, blah, 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 all kinds of stuff, and then the digestive stuff. Yeah, let me have your hand. And here. And show me weak here. Good. Safe and appropriate for you to surrogate for Lupe. Yes. Safe and appropriate for Lupe to receive you. Yes. Allergy symptoms. Yes. These allergy symptoms are the result of lung issues. Yes. These are also the result of digestive issues. Yes. This requires a complete diagnostic. Yes. Okay? You're going to find all that stuff. Allergies are always the entire tube. From this end of the tube to this end of the tube, the mucous membrane is upset. And then we're standing there looking in the mirror going, hey, what's wrong with this end of the tube, without realizing the irritation is tuberculosis, pneumonia, mono, Epstein-Barr, candida, parasites. A whole tube is upset. And we can definitely give him some remedies that will help with symptoms. But he would be taking those forever, right? As opposed to dealing with the core issues and getting the stuff out of the lungs and the stuff out of the digestive tract. So this is not a single issue thing. Well, it is a single issue, it's just complex. It needs a bunch. Okay? Okay. Surrogation with Lupe is complete. Okay.
And also do one separate.
Yes,
Oh, thank you.
of course, Joe.
I think that's, is that my pen?
No.
Thank you.
So who are we interested in? Fred. Fred, okay. And Strong.
Write that down.
Safe and appropriate for you to surrogate for Fred. Yes. Safe and appropriate for Fred to receive you as his surrogate. Yes. What's going on with Fred?
Back issues, back pain.
Okay.
They keep trying to get him to have surgery.
Okay. Back pain. That's our stressor, weak response. So the back pain is a physical plane issue. Yes. So this is 100% physical plane? Yes. This is soft tissue. Yes. There is bony tissue involvement? No. Okay, so this is 100% soft tissue. Okay. This is the psoas muscle. Yes. Psoas muscle is more than 90% responsible for the low back pain. Yes. More than 99% responsible for the low back pain. Yes. This requires structural integration.
Yes. What structural integration?
Go and see Bob.
Body work.
Yeah, Robert can fix this. You know, it's soft tissue. Okay. Surrogation with Fred is complete. Okay?
It's interesting.
You
Sure.
did.
So that's one thing to remember is that the low back pain, I mean, more than 90% of the time, it's the psoas muscle. That's PSOAS, the psoas muscle. The psoas muscle, it's this huge muscle on the inside of your body. It's on the front of your spine. You can't see it, and so we're completely unaware of it. And this huge muscle controls our trunk. It controls our pelvis. It lifts our leg with every step. It does so much work, and we end up abusing it. And I remember when I was a practitioner of structural integration, low back pain, more than 90% of the time, just immediately go to the psoas. That's going to be it. Okay? So that's something to remember when people come to you with low back pain. Trust me, most of the time it's going to be the psoas. Okay.
I think you did that body work on me once for the psoas, and I was